pressure before.
Yeah, but it's been a long time.
You have not. Have you? Yeah, taking somebody's blood pressure, not taking your own. Okay, well, I'm going to explain to you how you do it. If you remind me in lab, we have them. I'll let you try it in there. Okay, so blood pressure. We take blood pressure with a sphygmomanometer. That is such a hard word to say. It took a lot of practice. So that is the thing that you wrap around the arm, okay? So you're gonna have your patient usually sitting, but they can be laying down or they can be standing, weird, but best is have them sitting, feet flat on the floor, so don't let them cross their legs, and then their arm needs to be relaxed. You don't want them like holding their arm up while you're trying to do that because that would be contracting the muscle. You want the blood pressure cuff to be constricting, not the muscles constricting, okay? So you have relaxed just like this, feet flat on the floor, and you wrap the cuff around it. You have the tubes coming out front, okay? And then usually there's a round, like gauge, I think is what it's called, that kind of hooks on it. So you pump, and as you're pumping it up, it is going to completely block off the brachial artery, okay? And what is the name for arm? Brachial, right? So it's gonna constrict, not constrict, but like pinch off the radial artery. So you would go up to probably about 160, 180, ish. If they have a history of high blood pressure like I do, I would probably go to 200 just to make sure. Or you can start at kind of going up to the 160, 170, and then if you don't get it, you could try again because it may be too high. Okay, so you blow it up. And then you put the stethoscope, the big side right here on the antecubital, also called cubital fossa. Okay, and then you listen. So you're gonna take the little nozzle thing right here on the bulb and you unscrew it a little, not a lot, because the more you unscrew it, the more the air goes out and the faster the little needle's gonna go. Okay, so you unscrew it a little enough to have the air starting to come out normal stream and you're listening. Okay, the very first that you hear, that is your systolic number. That's the top number. Okay, and then you continue to listen and you're looking at the needle. Okay, so before the first you're just gonna watch the needle going down like that, and then you hear and you look and see what number is that, write that down or remember that. Okay, and then you're gonna continue to hear it and it's gonna go and we stop hearing it, you look and that is your diastolic number, the one on the bottom. Okay, so everybody says, oh, it's supposed to be 120/80. That's average, that's great, that's perfect, but we know that normal is a range. It's a range. So 110 to 140 on the top, 70 to 80 on the bottom is the best range, okay? So blood pressure is measured as systolic over diastolic. Systolic is the first that you hear. Diastolic is when you stop hearing it. The systolic is the contraction. The diastolic is the relaxation, okay? So you're gonna figure out your pulse pressure, which is the difference between the two. Okay, the difference between the two. And then your mean arterial pressure is the diastolic one on the bottom, times 1/3 of the pulse pressure, 1/3 of the difference. Okay, you won't be asked to do any math, but understand where these come from. Another thing that I was going to say, especially if you're in an ambulance that's really loud, you got the siren on, stuff like that. I'll get back to it. You might not be able to hear very well when you're trying to take blood pressure. Do y'all have like an automatic one that does it for you, or you have to have both? Huh?
life packs have, like the automatic.
Oh, okay, yeah.
It's all that. But if you put your feet on the rails of the stretcher, you can actually hear it better. Don't ask me how it works.
You put your feet on what?
If you put your feet on the rails of the stretcher, like while you're sitting next to them,
Uh-huh.
you can hear it better.
Oh, interesting. Bone conduction, maybe?
And, well,
Because you know that we hear through bone conduction through like the vibration and neurological through the, you might not know that we skip special senses. So this is what I was gonna say. If you can't hear very well, if you look at the needle, it kind of twitches a little bit in between the two. So, which is the pulse pressure, right? So when you get to the systolic, that first that you hear, you're gonna watch the needle and it kind of vibrates. Have you paid attention to that? Well, that's a lot of movement. Ours
It's not
are
like
pretty.
that much, but it's just like a
Yeah, it's
tick, and then
yeah. So you can look at it. So when it starts kind of ticking like that, that's when you usually hear the first, which is your systolic. And then you can watch it. And then when it stops twitching, that's usually when you're stopping hearing it. And that's the diastolic on the bottom. We were at what, 40? Here we were. Did I tell you all that I had high blood pressure? Did I tell you I have high blood pressure? I was diagnosed when I was practicing. My dad was really sick and in and out of the hospital. He had congestive heart failure. I had just gotten divorced, single parent, one income, working full time, having to put the kids in, after school care too. Like, it's a lot. My dad was sick. My stress levels were right up here. So I sat down between patients one day and y'all, I could feel my carotid pulse without my fingers. Like I could feel it pulsing in my neck. And I was having a lot of headaches too, which is another thing that it will cause. So I took my pressure and it was 190 something over 90 something, which is like stroke level. I could have stroked out any minute. So I did go to the doctor and I got on blood pressure medicine and a diuretic. What do diuretics do?
Lower your blood pressure.
Huh?
makes you pee.
Makes you pee. Okay, so follow me here. The more you pee, the lower your body fluid volume, the lower your blood volume, the lower your blood pressure. So you're getting out more fluid, which is the opposite of eating a whole bunch of salt because water follows salt. Say that with me, water follows salt. Okay, so if you ingest a whole bunch of sodium, your body has to hang on to a whole bunch of water to make sure that you stay 0.9 saline, right? You can't be too salty. You can't be not enough salty. You have to be 0.9 because then your cells will start changing sizes. Remember we talked about hypotonic, hypertonic. Okay, so you have to maintain that 0.9% saline. Okay, so I was able to come off of that pretty soon after it. And, now I'm just on my blood pressure pill for the rest of my life, I assume. So anyway, what controls blood pressure in our bodies? I was just talking about the diuretic making you pee, which lowers body fluid volume, which lowers blood volume, which lowers blood pressure, right? So we also have hormonal regulation that does that same thing, right? And we've already talked about this with the endocrine system. So the kidneys, the renin-angiotensin system, do you remember that? What that is going to do is stimulate the angiotensin is the active form. Do y'all remember that any? But it stimulates the release of aldosterone. Okay, and aldosterone causes sodium reabsorption. Okay, and what follows the salt? Water. Okay, so why would you want that to be released? when your blood pressure is low. Okay? So I just like to say, okay, what if somebody is hemorrhaging? They're bleeding profusely. They're losing a lot of fluids. Okay, so this renin-angiotensin cycle will start, and it is going to stimulate aldosterone, which comes from the adrenal cortex, right? So it stimulates that, and aldosterone causes sodium reabsorption. So then water is reabsorbed with the sodium. So now we're increasing body fluid volume, which will increase blood volume, which will increase blood pressure. Okay, so that's the kidney, and it's just asking for help. Okay, this should say it is the adrenal medulla, the epinephrine and norepinephrine. That's adrenaline, right? So that increases blood pressure. We also have the aldosterone that's coming from the adrenal cortex, the outside, that I just talked about with the renin-angiotensin. It says reabsorb more sodium. It tells the adrenal cortex to release aldosterone. You want me to write those down? I feel like I'm going in a circle. Let me try. Okay, so kidney. Renin, angiotensin. So the renin stimulates angiotensin, ogen, okay? And ogen means in the beginning Genesis, right? So it begins as angiotensin ogen and then is converted to angiotensin, which is the active form, by ACE, which is angiotensin converting enzyme. You don't need to know all that. But what this does is tells the adrenal cortex to release aldosterone. Okay, so this is the adrenal cortex, and the aldosterone reabsorbs sodium, which also reabsorbs water, which will increase blood pressure. Okay, and then I already said from the adrenal cortex we have the aldosterone, right? We also have epi and norepi, and this is from the adrenal medulla. Okay, and that is adrenaline. Okay, and this increases blood pressure as well. Why? Because it's adrenaline, sympathetic nervous system. Sympathetic nervous system. Okay, fight or flight, adrenaline. And we know if you're being chased by a rabid dog, your blood pressure goes up, your heart rate goes up, your respiratory rate goes up because you're running. Just think about everything that happens in your body if you're running really fast on a treadmill. Well, you might start to get out of breath. So you start breathing more rapidly, increase the respiratory rate. Why? Because you're going to need more oxygen. Why? Because aerobic cellular respiration, you need oxygen to make ATP. And if you're running to get away from a rabid dog or running on a treadmill, you're using a lot of muscle and energy, so you have to make more, right? Okay, so sympathetic nervous system increases blood pressure with the epinephrine and norepinephrine. Let's say that this is renin, angiotensin. I'm not sure that's spelled right. Okay. Okay, and then posterior pituitary releases what? antidiuretic hormone. Okay, and this is from the posterior pituitary, but where is it made? Hypothalamus. Right, it says, so it tells kidneys. To reabsorb the water, which increases blood pressure, right? Because anytime you're reabsorbing water, you're increasing body fluid volume, and blood volume is part of that. So anytime you're hanging on to more salt, you're going to hang on to more water, or just anytime in general that you are holding on to more water from antidiuretic hormone or from aldosterone, okay? Anytime you're hanging on to more fluid, it increases body fluid volume, blood pressure. The more volume inside, the more pressure inside the vessel. Okay, and then the last one, this is the only one that is going to decrease blood pressure. So I'll put that one over here. So this is the heart, and that is atrial natriuretic. Natriuretic peptide. ANP. Okay. So the baroreceptors. Oops. What does baro mean?
Pressure.
Pressure. Baroreceptors. Let's just say pick up. Is there another? I'm just gonna put that. So they pick up high pressure in the aortic arch and carotid. Okay, and then the ANP tells kidneys to release more fluid. Which leads to a lower blood pressure. Okay, so we have these baroreceptors, which are pressure receptors in the two biggest arteries that we have, which are the aorta and the common carotid. Okay, so they're the biggest, they're also right there at the heart. So they are under the most pressure, right? Arteries are the highest pressure vessels. So that is where the heart is squeezing, they're gonna feel the pressure the most. Okay, so these baroreceptors send information to the brain saying this pressure is too high. So the ANP is released from the atria. Okay, that's not a gland, but it's still a hormone. And it goes to the kidneys and tells the kidneys to release more fluid. So the more fluid is being released. So it acts as a diuretic. Okay. The more fluid is released, the lower your body fluid volume, the lower your blood volume, the lower blood pressure. Okay? All right, y'all good with this? Okay, what about temperature regulation? When you're cold, have you ever noticed that you become kind of white? That is because your vessels closer to the surface are constricting. Why? Because they want to keep the body warm. Okay, they want to keep the body warm. And so the more the closer those vessels are to the surface, the more heat you're losing from them. Okay, that is one way our body dissipates heat. Okay, so when it's hot, the vessels dilate, especially right here close to the surface, and that allows the heat to leave from your body. Okay, so, and then when you're hot, you're going to be red. Why? Because you got more blood flow coming to the surface trying to dissipate that heat. Kind of neat, huh? There are also some vasodilating chemicals that smooth muscle gives off, and it causes the vessel to dilate, which would decrease blood pressure. Okay. Oh, there's the picture right there, the baroreceptors. So what else does this say? So the baroreceptors will tell you if the blood pressure is high or low. And then that atrial, this is neural regulation. The nervous system, this is spinal cord. The nervous system would tell it to increase or decrease heart rate. Okay. All right. So regulation of blood pressure at the local level, local control, we have opening of precapillary sphincters. So these are the sphincters right there. And what are sphincters made out of? Circular smooth muscle, right? So when they're constricted, it's pinched off. So here, if you want that oxygenated blood to go into this capillary bed, then those sphincters are going to relax, so the blood will go through there, and then you'll get that gas exchange through the whole area. So when you open those sphincters, that's controlled by waste product and nutrient levels. So if there's like waste is in CO2, okay, or nutrients, if the cells in this area need more glucose to make more ATP, right? Then these would relax, so the blood will go through the whole capillary bed, okay? So it just depends on needs. If these cells are good right now, like they just got fulfilled everything they needed just a second or two ago, then the sphincters will stay closed and it'll just be shunted to the next one, okay? Inflammation. With inflammation, basophils, remember those are the white blood cells that are purple, okay? They're also the least numerous, so less than 1% of the white blood cells are basophils. But they are a big player in inflammation. They release vasodilators, which cause the vessels to dilate, get bigger. Okay. They also become more permeable too. Okay. Remember, if you were to cut yourself, okay, say I cut myself and I'm bleeding. Well, if I'm bleeding, that means that I went through the epidermis and into the dermis, right? Because the epidermis is avascular, no blood flow. Okay. So if I'm bleeding, my body's got to fix itself. And it does. It does. Our body repairs itself. It is fascinating. Okay, so what's the first thing that happens? Inflammation, right? So with inflammation, you're going to hear this 1,000 times. You're going to get redness. Okay, why? Because the vessels are going to dilate, go into the area. Why? One, because they want to take white blood cells. So if any bacteria or any kind of pathogen got in through that cut, it would take that out, okay? But more blood flow coming to the area, carrying platelets, right, to help stop the bleeding, and carrying those white blood cells to fight anything off, that more blood is going to cause the redness in the area. It is also going to cause the heat in the area. And the more they're dilated, the leakier they become. Okay, because I've got more blood going into an area that is feeding into these capillaries. So that's going to put more force in those capillaries, making the capillaries more leaky. Does that make sense? So the leakier the capillaries are, we know that they're leaky anyway because they're simple squamous, one cell layer thick. They're leaky anyway. So that's going to cause more fluid to leave the blood vessels, and that's what causes the swelling. Okay, and then pain because of the chemicals being released, as well as nerve endings, right? Neurons. So if you cut yourself, all that stuff happens. So we were talking about inflammation. Basophils are the biggest player in inflammation because they're going to release those vasodilators that will bring more blood flow to the area. It also releases chemicals that call other white blood cells to the area, because remember, they're the least numerous, so they need help. They need a lot of help. But the vasodilators that they release are a lot of help just with that. Reactive hyperemia, that is overdilation, following a lack of blood. And then angiogenesis is the growth of new vessels. Genesis means what? In the beginning, right? So we're beginning to make new vessels. Angio is vessel. Okay, angiogenesis, we're making new vessels. So here you only have this much. Here, now we're growing more, and now we've grown a whole lot of extra capillaries there. So what happens if you really need more nutrients and oxygen to an area, then you're going to grow more blood vessels going to that area. Have you ever watched the 700-pound person? I don't even know what it's called, but that's on TLC, something like that. Imagine the extra blood vessels that big of a person would have had to grow, because if you're getting bigger, then your vascular system has to get larger as well to supply all of that tissue, right? All the tissue in the body. So that is what happens. You're going to grow more. Okay, regulation. So we have the hormonal control. I already talked about this. So antidiuretic hormone has the name vasopressin. It increases blood volume and blood pressure. Okay, why? It goes to the kidneys and says, reabsorb more water. Okay, the more water is reabsorbed, the more body fluid volume, the more blood volume, the higher the blood pressure. Okay, aldosterone increases sodium ions. Why? Because it tells the kidneys to reabsorb them. Okay, that's somewhere. I could put kidneys. So it tells the kidneys to reabsorb more sodium. Okay, that causes water retention. Why? Because water follows salt. And it increases the effects of antidiuretic hormone. Okay, so antidiuretic hormone tells the kidneys to reabsorb more water. Aldosterone tells the kidneys to reabsorb more sodium, which also is more water along with it. Here's that angiotensin 2. It is a potent vasoconstrictor. It also increases resistance in the blood pressure. So that's angiotensin 2. That is your active form. Okay. It also stimulates the release of aldosterone. Okay. And then epinephrine, that is adrenaline. What does it do? It causes vasoconstriction, and it increases blood pressure. That's just one of the things that happens with sympathetic nervous system anyway. And you only get the epinephrine release if you switch up into sympathetic nervous system. Like if I ran and jumped on a treadmill and started running right now, epinephrine would be released, right? When I tore my hand, epinephrine was released. Did it hurt? Yeah, but I was more in shock than in pain because I was full of adrenaline. You know, it wasn't really until I got to the hospital that I started crying. I was like, "Yeah, this really hurts." You know, epinephrine, it can make you pick up cars. It's crazy. Okay, so all of these things are going to increase blood pressure And then what is the one that helps to decrease blood pressure? AMP is the only one that decreases blood pressure. All of these are going to increase blood pressure. All right, so neural control, we have those baroreflexes, so baroreceptors. High blood pressure stretches the carotid arteries. See, in the aortic arch and carotids where those are, triggering a reflex that decreases blood pressure, okay? That reflex is telling the heart, the atria of the heart, to release that atrial natriuretic peptide, okay? Chemoreflex, if you have high carbon dioxide or acid levels, CO2 is acidic, okay? If the blood is too acidic as well, it triggers vasoconstriction and increases blood pressure. And then if you have medullary ischemic, what is that? Ischemia, low oxygen levels. So this is a direct monitor of cerebral blood pressure. It increases blood pressure and blood flow reduces to the brain. So if you have increased sympathetic activity, so sympathetic nervous system, it causes vasoconstriction, okay? And what happens to blood pressure with sympathetic nervous system? It increases blood pressure. It increases heart rate. It increases respiratory rate, all of that. And if you have a decrease in sympathetic activity, or if you are just chilling in parasympathetic mode, that causes vasodilation. The effects of exercising on cardiac output. So exercising triggers sympathetic nervous system, right? So you can either be running from that rabid dog, right? I'm scared to death that I'm going to get eaten by this rabid dog. You could be running from that, or you could just simply be running on the treadmill. The same thing happens, sympathetic nervous system. So exercise is going to increase cardiac output by raising the heart rate and the stroke volume. So the heart muscle becomes stronger. The more you work out, the stronger your heart becomes. The stroke volume is higher at rest, and the heart rate is slower at rest. So what happens to your body? Systemic effects, you have skeletal muscle hypertrophy and hyperplasia. So we're growing more muscle tissue and making it bigger. That's awesome. And then vascular, we're going to increase the flow. We're going to increase vasoreactivity. Have you heard of people like jumping in one of those ice water tanks and then jumping in a hot tub and then going back and forth? That's vascular exercise. That's really good for you. But just running just any kind of exercise helps with that as well. It also increases angiogenesis, the growing of the vessels, because you're getting bigger. So you're going to need blood flow to further areas, right? Metabolism, this is perfect. So it increases insulin sensitivity, right? So that's the opposite direction of insulin resistance, right? This makes your body more in tune to the insulin. Increase in oxidative phosphorylation and mitochondrial biogenesis and adipose browning. Well, what happens first? You start exercising and stuff. If you run out of glucose, your body can break down glycogen from the liver, right? So we can use that. Then it can start like not borrowing it, but just stealing it from the fat cells. Isn't that kind of what you want? That's exactly what I want. If I'm exercising, that is my end goal right there, is to shrink my fat cells. Okay, the cardiac effect. So it's going to help your heart as well. So you have hypertrophy and hyperplasia of the heart. Cardioprotection, you have less ischemic injury. Why? Because we have good blood flow. Good blood flow to it. It's going to get the oxygen that it needs. Function, we increase the stroke volume and cardiac output. Why? Because the more activity you're doing, the more oxygen that you're going to need, so that your cells, mitochondria, can do
Mm-hmm.
Let's see if I can explain that a different way. The higher it is, the more the body thinks that or the longer period of time that it is high, then these baroreceptors think that that is normal. So they're not going to do as good a job as they would if they were telling you that it was too high at that number. Do you see what I mean? So it kind of resets the normal level to a wrong high number. Yeah, that makes sense. Okay, what do we have here? Pathologies. Love it. This is the fun part. I like the diagnosing part. All right, valve disorders. A murmur is some kind of abnormal heart sound, okay? Prolapse. The valve in which the leaflet billows or it bends in a way that prevents it from closing properly. So remember we talked about those semilunar valves? How I said they look like 3 upside down umbrellas, okay? So the blood goes up through the middle and then it comes back down. And those little leaflets, the cusp of that semilunar valve, catch it so that you don't get the backflow. That's the purpose of a valve. Well, it can like flatten out. Now what happens? If one of them kind of flattens, then that blood can come back down through it. Okay, so if there's a problem with one of those little leaflets, stenosis is a narrowing of the valve and it causes incomplete closure. So if it's not closing all the way, then what? Then it's leaking. It's leaking, and you do have the backflow. So all of these problems with the valves are going to cause backflow of blood into a place where it's not supposed to go. So think about it this way. When the ventricles contract, they are pushing blood into the pulmonary trunk and the aorta at the same time. Okay? If you have problems with, let's say, the mitral valve, the bicuspid, if you have problems there, then the blood going into the ventricle from the aorta, when the ventricles squeeze, some of that blood may be going back up into the atrium instead of into the aorta where it's supposed to be going. So you have less blood flow going out, less output. Does that make sense? Okay. Arrhythmia, that is an abnormal rhythm. AFib, atrial fibrillation, is a condition in which faulty electrical signals cause the atria to beat very rapidly and in an irregular pattern. Okay, that looks like this on an EKG. Absolutely no cool PQRST waves, like random, no good at all. Brady's slow, so bradycardia is a resting heart rate less than 60 beats per minute. Tachy is high, so that's over 100 beats per minute. And then blood pressure disorders, hypertension, that is when it is higher than 140/90. So normal range, I said, was 110 to 120. No, sorry, 110 to 140 on the top and 70 to 80 on the bottom. Okay, that's your normal range. And then hypo is when it's below 90/60. That's pretty low. This is usually, it does say chronic. This is usually when somebody has chronic diseases. And it may be affecting the heart as well, causing a whole lot less cardiac output.
Can it happen if they're dehydrated?
Oh, sure. Yeah. You need the right amount of water every day. General rule is half your body weight in ounces of water a day. But if you're dehydrated, think about it. You have less body fluid volume, less blood volume. But we're talking about the liquid part of blood. So you have less plasma. Okay, now that's making the blood thicker because you have more blood cells than you normally would. Okay, and that makes it hard for the heart to pump it too when it's thicker like that. But yeah, you need the normal amount of fluids. Is that the last one or is there another one? Oh, there's another. Pre-hypertension. If it's between 120 and 139 on the top or 80 to 89 on the bottom, shock. So this is a life-threatening condition when the body's organ systems, especially the brain, are not getting enough blood flow to sustain normal function. There's different categories: cardiogenic shock, hypovolemic. That's what I was telling you. If you're hemorrhaging, you are losing volume. So, bless you, that is low volume shock. Septic shock, neurogenic shock. You're not getting the oxygen that you need. So that's very bad. Cardiac vessel disorders and aneurysm. It's a weakness in the arterial vessel walls that can balloon out. You probably heard of a AAA, abdominal aortic aneurysm, where it balloons out. It's supposed to look, it balloons out like my hand is right here. kind of balloons out like that. I think I've told y'all that I found like 3 of them on patients on thoracic x-rays, and I sent them to be checked because that's not something that you want to mess around with. If it's thinning out the wall because, you blow up a balloon, it stretches it, it makes it thinner, right? You don't want it to rupture because you probably usually die from that, right? Because internal hemorrhage. Arteriosclerosis, calcification of the apparoma or fatty deposits within the blood vessel. That is that's when is putting the plaques on the inside of those vessels. Atherosclerosis, condition that builds up the fatty deposits within the arterial walls. It causes the walls to roughen and project into the lumen. So it's blocking the blood flow, right? Coronary artery disease is obstruction of the coronary arteries. And what do those take blood to? The heart muscle itself. And that's usually caused by the arterio or atherosclerosis. What is a thrombus? A stationary clot. Thrombophlebitis, inflammation of a vein caused by a thrombosis. So the vein's gonna inflame so that it can still try to get the fluid around it, right? You have a blood clot. What is it called when it's moving? Embolism. Yeah. Varicose veins, those are veins in which dysfunctional valves cause the backflow and pooling of blood. When it's backflowing like that, it just stretches it out some. And then it's going to stick out the side of your leg a little bit right there. Looks like bulges on your skin from those veins sticking out. That's not the same thing as spider veins that look like the little blue spider webs. That's different. The varicose veins are from the blood pooling in the legs. Remember how we said with smooth muscle, instead of neuromuscular junctions, they have varicosities? And that word varicose is bulges. So they had little bulges surrounding the muscle that were full of the neurotransmitters. Do you remember that? So varicosities, that's bulging. Myocardial disorders, angina pectoris, a heaviness or pain in the chest caused by temporary or reversible myocardial ischemia. They say it feels like an elephant is sitting on your chest. Congestive heart failure, a condition in which one of the ventricles is not working as efficiently as the other. With this, you start out with problems with one side of the heart, generally the left side of the heart, and then it's going to create problems in the whole circuit, okay? Not just on that left side, it ends up affecting the right side as well, and then you have fluid buildup in the lungs that you get with that congestive heart failure. Myocardial infarction, that's a heart attack, and that is from ischemia, right? That's from the blood not getting to that specific part of the heart that needs it. So what happens to cardiac muscle? It dies, okay? In terms of scar tissue doesn't contract, okay? So if you don't have oxygen to the cells, those cells die and they won't contract, okay? Inflammatory cardiac disorders. So endocarditis is on the inside inflammation. Myo is inflammation of the muscle, the myocardium, and peri is what? Around. So pericarditis is inflammation of the pericardium, which is the serous membranes surrounding it. And what does inflammation do? Causes swelling, okay? So what happens if you have a whole bunch of fluid in between those layers? It's gonna put pressure on the heart that's on the inside too. No good. Okay, atrial septal defect. That's a hole in the septum that separates the right and the left atria. Occasionally, babies are still born with this hole there. It was called the foramen ovale, the little hole between the right and the left atria. It's called a foramen ovale when it's still open. Foramen's a hole, right? And that is the way it is until right before birth. And then it fuses, okay? Why? Because the babies don't need the blood flow going to the lungs yet. They're getting oxygenation from mom, okay? So it is allowing the lungs to mature. And so the blood is just being sent around the baby's body. So it comes to the right atrium, superior inferior vena cava, and then it goes from the right atrium, left ventricle, or left atrium, left ventricle, aorta to the body. So it's skipping the lungs altogether. All right. So if you still have that hole in there after the baby is born, the lungs are supposed to be working, then it's going to send some of the blood from the right atrium to the left atrium, skipping the lungs, right? So you're going to have a mixture of oxygenated and deoxygenated blood. So you'll have some of that deoxygenated blood going back out to the body that went from the right to the left. Does that make sense? So they'll watch it usually, and then if it doesn't close really quickly, they'll go in there and close it up. Okay, congenital valve disorders. The word congenital means you're born with it. So it can include stenosis, or the valves are too narrow, atresia, a valve lacks a hole for the blood to travel through, regurgitation when the blood is going back through it, if it doesn't close tightly enough. Okay, a patent ductus arteriosus is a failure of the ductus arteriosus to close after birth. Tetralogy of Fallot. Tet means four. So these are four different things that happens. Pulmonary valve stenosis, the ventricular septal disorder, overriding aorta, and right ventricular hypertrophy. That ventricular septal defect is a hole in the septum between the two ventricles. Okay. So you can have some of the deoxygenated blood that's supposed to be going up the pulmonary trunk going straight into the left ventricle that's going to the body. So you can have deoxygenated blood circulating to the body. Okay. Other cardiovascular disorders, cardiac tamponade is a buildup of excessive fluid in that pericardium, and excess fluid will put pressure on the heart. Rheumatic heart disease is from rheumatic fever, and it results in carditis and valve stenosis. I think that's it. Is that the last one?
Yeah.
Y'all can watch that on the lymphatic system too. What else I was going to tell you? Oh, I know what I was going to tell you. Did you know that the rate of myocarditis has spiked really, really, really high since, I'm just going to say 2020? Don't know that? Probably from the jab. I'm just saying. If you work in a hospital, I know that you probably had to take it, but if you have the opportunity to say no to certain things, you might want to do your research and decide on your own whether or not you want those things. Just saying. Especially if you don't know long-term effects of them.
It was created too quickly for mine.
Yeah, a normal vaccine, well, that's a long time. 10 years is a long time. I didn't know it was that long, but they do take a long time. And we even learned that they've been working on a vaccine for HIV since the 80s, maybe even the 70s, and they still haven't gotten one. So that's kind of scary. Anyway. I'm not saying anything else about vaccines. Y'all can do your own research. All right, I'm done. Y'all study hard. Study hard. Your homework, I did change it, right? I did change the due date. Okay. So get all your homework done. Zeros hurt your grades. Turn in stuff. All right. See you Thursday for history.
Yay.